economic impacts of New Mexico COVID response. And we've got 3 presenters. I think they're all connected on that. And I don't know what order they were planning on starting in and who drew the short straw, but let's go ahead and get started.
Yeah, Mr. Chairman, good morning.
Okay.
Secretary Scrace will start our panel this morning, followed by Dr. Finch and then Dr. Peach, and then I'll wrap it up.
Okay, we've got, from a time management standpoint, we've got 2 hours, and I want to make certain we have time to ask questions, and so make certain your presentations allow adequate time. We're trying to get out of here somewhere close to 11 o'clock. The next presentation will be starting at 10 o'clock on that, and go from there. So let's go ahead and get started, Dr. Scrace.
All right, I think we've planned out our time today to allow for more than half the time allotted for questions. So I think that will work. I did want to just say one thing before I get going, and this is something that I saw people do in Vancouver when I was there a long time ago. And but just on behalf of my colleagues at the Human Services Department, to acknowledge that we're on the traditional lands of the First Peoples of what we now call New Mexico, including its pueblos, tribes, and nations past and present, and wanted to honor that fact with gratitude for the land and these communities. So with that, I'm going to go right into it. I'm going to talk today a little bit about how we set things up to review medical literature, review data, and to make recommendations to the governor and the legislature. One thing to start with is that probably the most common question I get asked is, how did you guys decide that, or where did that recommendation come from? And remember that the coronavirus is called the novel coronavirus, novel meaning new in Latin. So when we started in March, we had very, very little reliable research information to guide decision making. Fortunately, we have very experienced scientists and epidemiologists. I'll tell you a little bit about them in a minute, who could guide us using good judgment. But we do use scientific evidence wherever we have it. But I want to make it clear that we don't always have it because of the new nature of the virus. This graph here just shows this rise in non-peer-reviewed literature. These are people literally throwing together a research study and throwing it on the internet without the normal time it takes to actually have your work reviewed by other scientists and corrected. And so in the early days in particular, you can see almost 35% of all research was this non-peer-reviewed blue documents. And there was an awful lot of unpublished data that went out here as well, just very large amount of. So we try to use data. We set up
We've lost you. Mike Wallace is trying to figure out how to do that.
that we immediately went to when the pandemic began. You can still find that online. Okay. It talks about the need to have a science and medical advisory group to help with planning, developing recommendations, guidelines, protocols, providing guidance. And in particular, and a huge role we've had, as you'll see in a minute, is addressing emerging questions that come up, because there's a lot of emerging questions in a new type of viral pandemic. We've had over 170 people participating in this, including state staff, healthcare providers, public health practitioners, data analysts, legal, ethical experts. A lot of help has been received from the University of New Mexico, and we're very grateful for that as well. This arm is, though, purely scientific, no real policy activity, just makes recommendations. And on the economic side, there are a couple governors' economic related councils, a mayor's council, and an economic recovery council. They've worked very hard also to develop COVID safe practices. There's a very lengthy, detailed document online. And in these slides, which we have made available and will make available of this updated version, all you have to do is click on a link and it will take you to the documents in question. So the medical advisory team, you can click on here to see that website, and here on the COVID safe practices. These two bodies feed into the governor and her team, and the data produced by both is used to make decisions about reopening, which is the primary topic of our conversation today. I'm pretty sure you can't really read this slide very well. It's slide number 5, but it's the organizational chart of the medical advisory team. You can see it's complicated, that we've had a huge number of different committees going, an operations team that sort of leads the effort, a hospital and health system committee that continues to be active. Some of these teams come up and do their work and then go back on a hiatus, and then they're called up again. And so right now, very active testing team looking at new testing that's coming out, a vaccine team looking at a scientific way in New Mexico of evaluating our own, the national data and making sure it's safe for the people of New Mexico. We had a call center up during the early part of the pandemic to coordinate transfers from outstate to Albuquerque to where most of our ICU beds are. The modeling team has been and remains probably one of the most active teams, and the MAT still meeting weekly, 30 people going over the data. And you'll hear a lot more about that today from Len. I'll say a few words. We have an active behavioral health team preparing us for that behavioral health increase we're expecting now as we get through the pandemic, and skilled nursing facility committee still meeting, our team meeting every single week. So this entire structure comprises the medical advisory team. I'm not going to spend any time really on these next few slides, just so you know where you can find this information. But you can go to the medical advisory team website through the DOH primary website and see all the 50 plus papers that have been written and posted for you and for the public and for scientists and others. Some of them are a little on the scientific side, but where it was really important, we had multiple versions to address both the scientific community and administrative healthcare administration community and the public. So those are available, and if you go to the website, you can see all of these documents there. In all, we've answered a lot of questions, some recent ones. We have an FAQ out there, frequently asked questions and answers for the most common questions. We've updated our hydroxychloroquine recommendations 3 or 4 times now. We're now at the point where the evidence shows that it really isn't an effective way of preventing or treating coronavirus, and so we're no longer recommending that. Long-term care facility recommendations, new testing recommendations, and new types of tests come out every week, and so we're also reviewing testing, and there's a detailed set of recommendations. I won't go through all of these. In very fine print here, the 70 plus topics that we've been asked to provide scientific opinions, and you can see them here. And most of those ended up as online documents. So that's the MAT. That's the part that brings the scientific point of view to the table. Where there is science, where there is reliable research, we use it. We use it every time. But again, that's not all the time. And when we don't have that, we just try to combine what research and evidence we do have with our best judgment and career experience with other pandemics. And we have had, some of us have been experienced with H1N1. This is an updated version of what you have in your slides. Yesterday's graph, the dotted blue line is the number of cases per day. By date of specimen collection, it's a little bit different than what we report in the daily press releases. And you can see we've been up and then a little down. This was Otero County and a correctional facility, and then way up statewide with peaks, particularly in central New Mexico here, and then a significant drop off and now this uptick again. And these 5 lines below are the different regions of the state. I won't go through them one by one, but you can see that all of them are increasing the number of cases over the past week. This has a 6-day lag in reporting, so we know our numbers are even higher. Expect it to go up further. This is the total number of positive cases since the inception of the pandemic here on the left by county. And what really is new is that things have really settled down in the northwestern part of the state, although, again, cases picking up everywhere. And Doña Ana, the southern part of the state, and particularly the southeast right now, is where we're experiencing the highest number of cases. This is the total number of cases just in the past 14 days on the right, since the inception of the pandemic on the left, just the past 14 days on the right. And you can see these red counties where the most cases are. The darker the color, the more cases. Bernalillo, of course, has a huge part of the population, but again, this clustering in the southeastern part of the state. This is a slide you don't have in your packet, but just want to show you really quickly. These are the average daily number of new cases over the last 7 days by county. And you can see again, reinforcing that southeastern part of the state, that Eddy, Chavez, Lee, Lincoln, Curry, Doña Ana, Socorro, all above the state average, which is shown here in orange. And this is again corrected for county population. So that's what makes these bars as big as they are. I won't spend a lot of time on this. If you've seen a press conference, you've seen it, but it just shows that New Mexico started announcing that we were seeing a shift in cases from older people to younger people. And now you can see that 20 to 29-year-old age group leading the pack in terms of COVID cases. The federal government just announced that they have been seeing this trend now a couple months later. So we do have good data, and we are able to interpret it in real time, which is a big advantage compared to some of my friends in other states. On the right, you can see again that the highest death rates, which have been consistent since the beginning of the pandemic, are in older people. But when you have the 20 to 29-year-old age group with the most cases and almost a 1% mortality rate, that represents a tragic loss of a lot of young people in the early part of the prime of their life, and something we do not want to continue to see. We also track very closely hospitalizations. This green line is that total cases in New Mexico that you just saw. The gray line is hospitalizations. The red line is deaths. And we know now that hospitalizations lag cases by about 2 weeks, and we're starting to see this curve uptick. It was about 80 cases yesterday, and so that's starting to turn up as well. Deaths usually follow hospitalizations by a couple weeks as well. And you wanted to talk about the gating criteria today. New Mexico has 4 categories of criteria with 2 measures each. The 4 criteria are the spread of COVID, testing capacity, contact tracing and isolation, and the capacity of our healthcare system. We've been working hard. We were one of the first states to come up with gating criteria. I think only California had theirs published. We looked at what New York and what California were doing. We also looked at other countries, and everybody pretty much emphasized spread, testing, contact tracing, and statewide healthcare system capacity. These metrics and their targets have evolved actually surprisingly little, but they have evolved a little bit. We added a second measure for the first 2 categories with the daily case rate and the test positivity rate as more scientific data came out saying that these were important areas to focus on. And so these are available on the website. You can click here. It will take you to the website. I'm just going to show you what it looks like here, and you can click on any of these and see the graphs for these. This is all publicly available. It all can be reviewed as often as you like. But right now, for example, you can see that we're doing well in 6 of the 8 measures and 3 of the 4 criteria, but not doing well in case rates because the transmission rate has gone up with the increased number of cases. And so this is an area of big concern for the state, and one that can be adequately dealt with through universal wearing of masks and social distancing. I'm not going to spend much time because I'd like to move on to modeling New Mexico at the national level. There are multiple gating criteria and evaluation systems. We happen to be the closest to this one that's put out by Duke. And you can see if you look at their numbers and categories, very similar to the ones we use. Won't spend a lot of time in detail. And then we're starting to report metrics on the county level. We did that in August in order to determine nursing home visitation. And as you know, we're now using it for school openings, what communities are safe to have school openings. You can see this graph here, of red counties, and it seems like I've lost my ability to use my mouse, so I apologize for that. But on the left, this is our weekly openings, and on the right, this is one of the modeling maps created by Lanel that you're going to hear about just in a little bit. But that southeastern part of the state, anywhere where you see red and orange, that's a hot spot. But you can see that there's extensive hot spotting along the entire eastern New Mexico border with Texas. And if anything, that interface that we have with Texas, they also have significant number of cases there. And that may be a partial explanation, anyway, of why we're seeing so much in the Southeast. We get questions about testing, and we are working with our delivery system partners. You can see that this is the number, the percentage of people in each of these counties, non-duplicated people who've been tested. And you can see the testing is probably the highest in the Northwest. The Navajo Nation did an amazingly good job with testing. We've had a lot of testing in Hidalgo County as well, but we're working now with delivery system partners and within the DOH to expand testing there. So we've been modeling ever since the beginning. My friends in other states envy us. They're just sort of trying things and seeing what happened. We have the ability to model things like school reopenings, and I don't want to steal Lanel's thunder, so I'm going to actually walk through this. But as our understanding and the medical science and research grows, we're going to be able to do a better and better job predicting what things are going on. Right now, school modeling takes us up 4 weeks ahead of right now in various scenarios, and other states are looking back 4 weeks. So in many areas, we're up to 8 weeks ahead. But the gating criteria we feel confident in. They're serving us very well. They're giving us accurate data, and when coupled with modeling, allow us to have a fairly good idea of what we are going to see in the future. And with that, I'm going to immediately turn it over to Patrick Fitch to talk about Lanel. And sir, are you going to share your screen, or do you want me to share your presentation?
Either way.
All right, let me just, since I'm already hooked up, let me just do this. Can you see your presentation there, sir?
I can. Thank you, Dr. Scrace. Appreciate it. Good morning, everyone, and thank you for the opportunity to present the work we do together with Dr. Scrace and the team for New Mexico State. My name is Pat Fitch. I'm an Associate Lab Director at Los Alamos. Next slide, please, Dr. Scrace. I wanted to cover a little bit about the lab. I'm sure most of you are familiar with the lab, but the perspective here is that as a large organization based in science and technology, we're using the same type of tools that we're going to describe here that we're doing in collaboration with the state to help manage our own 10,000 plus person workforce. We're also supporting FEMA, CDC, Department of Defense, and others at the national level with similar types of work. As an institution, we've maintained our operations going down to about 20% of people on staff, and now around half the people on staff in a typical work week, most of them not on the same day. We're still maximizing our telework. We have an in-house lab testing capability that's been designed to support our occupational medicine's plan for principally asymptomatic testing and support our screening for people to come on site. And then the final thing which we're going to emphasize today is the epidemiological modeling. The folks who do this and have been interacting weekly with Dr. Scrace and the team in New Mexico, Sarah DeValier, Paul Fenimore, Carrie Minori, and Kirsten McCabe, done a phenomenal job giving up lots of nights and weekends to help make this happen. Next slide, please. So for modeling, to put it into some perspective, and I'll start on the upper right side, which is a picture of the United States by state, and I've put the cursor over New Mexico, and this is from September 23rd. And this is more like nowcasting. It's just a simple way, and Dr. Scrace had several examples like this. The Johns Hopkins website has something similar to see very quickly what's going on around the country. We also do the rest of the world by country, not by state. And then what we provide, in addition to this, is a statistical approach. So there's no model of the disease in this. It's a set of statistics to project from where we're at today using data that are available to where we predict we are up to 6 weeks out. And we stop at 6 weeks because the uncertainty at that point has spread enough that we've been told by decision makers that at that point it really isn't useful beyond 6 weeks. This approach was validated using influenza over the last 5 years. In fact, we were one of only 2 sites referenced by the CDC as the pandemic began for this type of forecasting. We also do several other kinds of modeling. There's only 2 we're going to talk about today. One of them is called EpiGrid, and that's a differential equation model. It's just a set of homogeneous bins that you can put collections of the population in: susceptible, exposed, infected, recovered are the traditional bins that you'll see in most textbooks. We have the flexibility, because of the expertise at the lab, to redefine those bins in ways that help address questions that are useful to decision makers. The other type of model we use is an agent-based model. Our model is called EpiCast. And agent-based is exactly what you might expect. It's each person is represented, not by individual name, but as an entity. And this was a conversion of a code we used for molecular and atomic simulations, where each molecule or atom were simulated. We mapped that over to doing people about 7 years ago. It has access to a tremendous database. That's all the good news. Unfortunately, it's computationally intensive, and even on the larger computers, it takes several days to run one scenario. And so it's used sparingly around the types of scenarios where we really want that level of resolution, and the decision makers can work with us around what the right questions are to ask. On the left side in yellow is an important set of interactions, and Dr. Scrace really highlighted this, and I want to reinforce that the modeling only makes sense in the context of the situations and scenarios that decision makers are interested in. And we do our best to provide confidence bounds and other types of quantitative scientific feedback. This is all challenged by the availability and the quality of data that we have. And this is something that the modelers have to weigh in on in terms of how it affects the ability of the software and the algorithms to perform correctly. And the decision makers have to weigh in terms of what type of data are most relevant and predictive. So in the end, the loop, which is not drawn here, that comes back from the model results to the decision makers is the most important one. And those discussions is where our team works with Dr. Scrace to understand whether the models are useful and in the end are helpful to decision makers. Next slide, please. I'm going to end my presentation with a couple examples and not really go into the details. And these are from back around September 1st, some calculations we did, and I'm pretty sure all of these are available on the web. The one on the left is the EpiGrid code, the one I mentioned, that has these different boxes you can put people in: susceptible, exposed, infected, for instance. And the key point of the 3 charts is you have New Mexico on the left, and you see a certain projection. The circles are data points going forward, and the details don't really matter. The key point of this chart is as you move over to County 1 and County 2, you see for County 1 a very similar projection because the data are similar. For County 2, however, the going-in initial conditions are quite different. And so this is a lesson we've been learning over and over again with COVID-19 that's a little different than influenza, which is the regional variability, or by nature, by geography, by demographic, can be quite different. And so the ability to pull these data out in ways that are relevant to the local or regional case is hugely important to supporting decision makers. On the right is an example from the EpiCast tool, which is the very computationally intensive model-based tool. And what's presented in the left part of the stack charts there is an assignment by age demographic to what percent of the folks are predicted over a long time period from August to March to have been affected, i.e. gotten sick. And so this is a very useful projection. It requires that level of detail. And then the iteration we're doing with Dr. Scrace and team is around the assumptions that let you do this calculation. And again, because it's so computationally intensive, we do only a handful of scenarios and then work that iteratively. On the right is something that's more similar you'd see in the news conferences and the like, is converting these numbers from percentage by age group into actual predicted cases by age. So those were the examples I wanted to present just to give some background. Want to, again, acknowledge our team at Los Alamos for their hard work and the great partnership we've had with the state, Presbyterian, and others. Thank you.
Dr. Peach?
Okay, well, with that, I'm turning it over to Jim Peach now to talk about economic aspects of COVID and future recovery.
Thank you, Mr. Chairman, members of the committee. Thank you for this opportunity to make some brief comments to you today. I do not have a set of slides today. You've seen quite enough slides, and I'll try to do my best without it. You have already had an excellent presentation on the economy during the budget update on Wednesday, and I'll try not to repeat too much of that. Reopening the economy and our educational institutions from pre-K to graduate school is something everyone wants. You have just heard from Dr. Scrace on the health aspects of the COVID crisis and gating criteria. An excellent presentation, by the way. Despite this uptick in cases, New Mexico has an excellent record in its attempts to suppress the virus, especially if you compare New Mexico to the surrounding states. Stopping the spread of the virus and the health of the people of New Mexico is the best path to reopening the economy. There is no question about that, and that puts the health team at the very center of this. But from the perspective of an economist, something is missing here. The economics discipline offers powerful tools to examine trade-offs, such as the trade-off between reopening some sector and the health consequences of it. At an elementary level, we teach every freshman and sophomore about opportunity cost. Opportunity cost is the cost of the next best alternative. It is not necessarily a money cost. The opportunity cost of me presenting to the LFC this morning might be perhaps a walk through the neighborhood, which I take every day, but I've already done that this morning. Surely it's possible to analyze the opportunity costs of various restrictions that have been placed on the economy. I may have missed something, but I see little evidence of economic analysis in the decision making. I was amused that, as far as I can tell, there is not one professional economist on the Economic Recovery Task Force. And I wouldn't recommend that that be dominated by economists, but certainly some professional economists and economic analysis might be useful. And by the way, I'm not looking for work. Any economic analysis performed as part of this process should be transparent and reported frequently, along with the analysis of the health-related team. Transparency on economic analysis could go a long way towards reducing public criticism of the restrictions that are necessarily in place. I really think that. At any rate, let's have some more economic analysis and make it transparent. Economists have models just like the healthcare industry does, and those are perhaps useful in this situation. Let me shift gears for a second, and let me congratulate the members of the Consensus Revenue Estimating Group for presenting a range of estimates a very first as far as I know. The range of estimates reflects the considerable uncertainty we face as a result of the current crisis. I understand that members of the legislature may be frustrated by the large size of the range, but it is appropriate. Please don't react the way that former President Johnson once did when his chief economist presented him with a range of estimates about GDP and unemployment. Johnson is widely reported to have said, "Get out of here and don't return until you give me a number. Ranges are for cattle." And he didn't like ranges. You'll get a point estimate in December from the presentations the other day, but I hope that the committee, Craig, will continue to provide the sensitivity analysis that they have done using various scenarios for a year or more. So you may not be through with ranges yet. Now, shifting to the economy itself. It is now painfully obvious that the relatively benign revenue tracking reports for FY20 and even the estimates for FY21 and 22 are mainly the result of federal largesse. New Mexico's economy is being propped up by massive injections of federal funds. This is especially true for consumption expenditures and hence for both GRT and the corporate income tax, CIT. Although the state has relied heavily on federal expenditures since the 1940s, but we've never seen anything like this. Just the other day, the Bureau of Economic Analysis released state-level personal income for the second quarter of the year. New Mexico experienced a 40.2% increase in Q2 over Q1 in terms of personal income. That's an astounding figure. It was not the highest in the nation, but it's worth noting that transfer payments increased not by 40%, but by 58%, while net earnings, think of that as mainly wages and salaries, decreased by 16.6%. So we have this massive injection of federal funds. It is no surprise that GRT came in higher than anticipated, and that CIT is likely to do the same sort of thing. Now, as of this morning, there had been no agreement on a second stimulus bill. So a lot of that injection of funds into the economy is going to come to an end. We would be very lucky to have a second stimulus bill. But even that would not fix the New Mexico economy. We face some really difficult times. As noted on Wednesday, in the budget update, both UNM's Bieber and Moody's both project that it will be 2025 before the state regains its pre-COVID level of employment. Yet at the national level, yesterday's Wells Fargo employment update stated a full recovery is still years in the making, as some businesses will not reopen and others will rely less on labor. We'll be lucky, really lucky, in 2025 to be back to where we were in January of 2020, of this year. It's just, we've been hit really, really hard. And, during the Great Recession, the maximum employment New Mexico lost was a little bit over 50,000 jobs. We're down today over 70,000 jobs as of August. The September data are not yet available. And earlier, we were down well over 100,000 jobs. We recovered some, and that's a really good thing. It's going to take a long time for us to get out of this mess. It's no way to do it instantly. When the economy does recover, it's going to look a lot different. The phrase new economy has been used a lot, overused, I think. But it's going to be just very, very different. Many others, including Rob Kaplan, the president of the Dallas Fed, has talked about some of these changes. And whatever we come back to, we'll have changes in consumer behavior, changes in the workplace, such as work from home, changes in business travel, changes in the industrial structure of the economy, changes in commuting patterns, and in many sectors, and this is really important in New Mexico, we'll have a higher concentration of economic activity in the hands of large corporations. These changes are not speculation. They are occurring now. That last item, that we'll have a more concentrated economy, concentrated in the hands of fewer firms, is really important in New Mexico. New Mexico is not the headquarters of large corporations. It's a really important issue. We're just not there. Now, New Mexico is not well positioned to face these changes in the short run or the long run. For the state to prosper and for businesses to recover, for the state to compete successfully under these circumstances will require very large investments by both the public and private sectors. To compete in this environment, New Mexico will need the very best educational and workforce training programs, including its universities, the best infrastructure, including transportation and broadband access, and even massive investments in state parks and museums. And I do know that it is difficult to make new investments in the midst of a budget crisis, but I think we're going to have to do that if we're going to come out of this strong and prosperous. New Mexico has been ranked in the low 40s, lowest part of the 40s, 45th and above, in terms of per capita income for over half a century, for as long as we have data going back. We've been sitting at about 80% of the national average. And that goes up and down a little bit depending on the oil industry and how well we've been doing there. But we've made little progress in terms of catching up with the rest of the country in half a century, and now we face a very, very severe problem. During the Wednesday budget update, Don Iglesias and the two secretaries observed that the oil and gas industry is not likely to lead us out of the current crisis very soon. Let me reinforce that if I can. The industry faces tough times. There was too much oil on the market a year ago. There were signs that the industry was in trouble last summer, and many people have noted that. And I did last summer at these hearings in August in Red River. A year ago, West Texas Intermediate was in the mid 50s, $55 a barrel. And that was a difficult time for the industry. We'd be celebrating if we had oil in the mid-50s. It's been dropping this morning. They claim as a result of the announcement about the president having COVID. But $40 oil is just not good. But even a year ago, there were signs of trouble. Energy stock prices were falling. Many exploration and production firms were pulling back on investment and laying off workers, and oil field service companies were in especially tough times. The typical downturn in the oil industry lasts about 2 or 2.5 years. And we've seen this many, many times. We've had downturns in 1986, 87, 93, 94, 2001, 2002, 2008, 2009, and almost all of us remember 2014 to 2016. In June 2014, West Texas Intermediate was $105. By March 2016, it was $26. And we got down to 13 active rigs in the state. This time around, we'll get more numbers today after lunch from Baker Hughes. But last week we had 41 rigs as compared to the 117 in mid-March. So we've lost a lot of rigs, and that eventually will mean a decline in production. At the September OPEC Plus meetings, Saudi Arabia introduced the possibility of an extraordinary meeting sometime in October if world or global demand does not return. There is simply more oil available than the world is consuming. That was true to some extent a year ago. It's even more the case now. Everyone in the industry seems to expect a $40 price for oil well into the future, and that is indeed what the futures prices indicate at the current time. The industry is announcing layoffs on an almost daily basis, including just the other day, Marathon Petroleum, which does operate in New Mexico, announced that they were laying off workers. One of the issues here with the oil industry is, of course, jet fuel. In a 42-gallon barrel of oil, we get typically 8 or 9 gallons, about 20% of jet fuel. And the demand for air travel just has not returned. That's reflected in the requests of the industry right now for an additional $25 billion bailout from the federal government. And the airline industry is conducting massive layoffs that started yesterday when the initial CARES Act aid for the industry declined. We've got too much oil. Prices are unlikely to go up anytime soon. New Mexico production has held up pretty well so far, and I hope that it continues to do that. But as a revenue source, that's pretty shaky stuff. So we find ourselves in the situation where federal aid is coming to an end, and the state's most important industry in terms of revenue for the state is in serious kind of trouble. The good news, of course, also as reported Wednesday, is that we currently have nice reserves, 29-something% at the end of FY20. And that's really good news, and we might be able to weather the storm. But we need to make serious investments going forward so that we can come out of this strong and prosperous. And with that, I will quit. I can talk about the oil industry all day long if anybody would like me.
Okay, we'll turn to questions now. Pardon? Oh, Charles? No, excuse me a second.
Charles
Thank you,
Charles
Mr. Chairman.
Sally is going to make some wrap-up comments.
Go ahead, quickly.
Sharon, if you can put my slides up. So, Mr. Chairman, members of the committee, the one thing that is certain in these strained times is uncertainty. You heard Dr. Scrace talk about that this is a new virus. The science is also evolving and new. One of the things early on that Dr. Scrace talked about, one of the biggest challenges with dealing with this COVID-19 was going to be the government's ability to communicate with the public and to get their buy-in. And the fact that science is evolving over time and resulting in different policy choices, or there's no science that guides policy choices, can undermine the public's confidence in decision makers with whatever they choose to decide. This is a really good example of early on the science was telling decision makers that we didn't need to wear these. We didn't know that COVID was spread amongst people who didn't show symptoms. That's changed how we approach interacting with people, whether it's limiting meetings to 10 people or more or less, whether that is testing people who don't have symptoms or testing people who only have symptoms. If the United States had a pandemic plan, somebody ripped it up or the dog ate it, because we are operating in an environment of 50 state laboratories trying to figure this out. That's further undermining the public's confidence in what the government's trying to do. So the majority of states are also not following CDC guidance. So the federal government has come up with certain guidance and states are going on their own paths. And I'm going to talk a little bit about that. Next slide. So New Mexico has been operating a performance management system since the start of this. They very quickly adopted gating criteria. These are performance metrics that the administration is monitoring, and they use as to inform decisions about what parts of the economy to close, what parts of the economy to open and when, what kinds of strategies to deploy. You heard Governor O'Malley in our August meeting talk about the difference between a dream and a goal is a deadline. We don't really have a deadline when we're going to come out of this, but the best case scenario would be hopefully by next summer, early fall. But we've got to have performance metrics to help guide where we're at. New Mexico uses more of these than any other state in the country with the addition of the two new gating criteria. Next slide. New Mexico is one of a handful of states with 4 or more phases to its reopening. Next slide. Some states are choosing to make these decisions jointly and on a regional basis. Other states are making them independently. New Mexico is making ours independently. Next slide. The lack of a coherent strategy from a national standpoint has also resulted in big impacts in how we're opening really the biggest sector of our economy for the future, and that's our schools. And you heard a lot about this the other day. And this summer, because of the lack of clarity and certainty over how to effectively open the schools, this issue became very, very political. And it's not based on scientific evidence about what's going on in a community. It's based on people's perceptions of the virus and the political environment that we're in. So you can have some segments of the country that have very high spread rate that are very supportive of reopening the schools in person. You can have sectors of New Mexico and the country that have very low spread rates and very low infection rates where it's probably safer to bring kids back in learning. You heard a lot of testimony this week from professional educators about the need for kids to have in-person learning where there's not support for that. This scatter plot shows these decisions are not being based on any scientific evidence whatsoever. That's going to have long-term ramifications for the country, for our state, in terms of the achievement gap, in terms of the gap in achievement of even affluent kids in New Mexico versus other states. My good friend that lives outside of Austin, 7-year-old, has been going in person 5 days a week like normal, wearing a mask since August. Within Santa Fe, you see the decision is up to the individual teacher on whether or not they want to come back to provide even partial in-person learning, even at affluent schools. So that's going to have long-term ramifications for our state if we don't figure this out sooner than later. Next slide. The guidance for decision makers, including the administration, is not clear. The CDC has certain guidance for reopening schools. You know, for example, the percentage of positive tests should be less than 15% for 14 days. New Mexico's target is that the test positivity rate over a 7-day average is less than 5%. So wide variation. The unions are putting out guidance for their membership and what policymakers and decision makers should consider. And that's shown in the middle. Next slide. Dr. Peach talked about, well, I'll get to Dr. Peach's testimony in a minute. The administration's been very good at looking at a host of different metrics as part of its modeling process. Movement is one of them, whether people are moving around within their communities at different levels. This is an example of the number of cases that Dr. Scrace talked about on the top part of this graph over time, and how much time people were spending outside of their home. The blue line is just total outside of their home, and you can see a steep drop-off during the initial lockdowns, moderate increases as those were lifted, and even when you're really not on a stay-at-home order, people are still staying at home, and we're down about 8.4%. This comes from researchers at Harvard and Brown University that are using private data from a host of different companies to give more real-time information about what's going on within the economy. It's called Track the Recovery website. But you can see very different impacts to this day on people going to grocery stores. You saw the initial run on grocery stores as a big increase, and then the drop down. Restaurants, very depressed and continuing to be down. Next slide. These overall patterns are very similar across states. New York, which was at the epicenter of the pandemic very early on, you see very similar trends with steep decreases in people moving outside, runs on grocery stores, then not, steep declines in restaurant. But even in New York, as their infection rates and the number of positive cases plummeted to some of the lowest levels in the country, people were still not returning to retail and restaurants, whereas grocery stores a little bit more. But overall, about 8% down, similar to Mexico. Next slide. Arizona, which had a late peak compared to New York. Again, similar trends where stay-at-home orders, steep drop-offs in people moving outside the home, going to restaurants. Again, increases in restaurants or increases in grocery stores. Grocery store visits in Arizona are down 9%, 18% for retail and restaurants, and 9% more than New Mexico and New York as of last week. Next slide. This site also tracks the number of small businesses that are open. It also tracks small business revenue. There's a host of different economic metrics that you can look at, and this gets to Dr. Peach's point that really to recover, we have to defeat or significantly contain this virus because of consumer confidence. There are no stay-at-home orders anymore, but people are still staying home at a greater rate. Small businesses are not recovering as people are staying home more. So you see in New Mexico that retail and transportation still down 24%. Everything plummeted and has stayed pretty low. Total businesses, small businesses open down 28%. Leisure and hospitality crushed it at minus 40%. New York, similar types of things. with small businesses not reopening despite low numbers of new cases over time. Leisure and hospitality there down 36%. Arizona, next slide. One more. Thank you. Arizona, same thing. Retail and transportation down 10%. Total small businesses down 21%. Leisure and hospitality down 36%. Very similar to New York and New Mexico. Next slide. Consumer spending. In New Mexico, this is another metric that this particular website tracks. Very different spending patterns when it comes to consuming food with grocery stores, and spending at grocery stores up almost 22% to this day, with big spikes like we saw in the movement, and restaurants and hotels, that hospitality and leisure sector of our economy, down 40%. Total spending overall down about 5%. Next slide is a duplicate, and then go to a slide that shows a map. Perfect. So this speaks to what Dr. Peach was also talking about, the need for basically a recovery stat, for us to be focused on both how to contain the virus, how to fight that, but also how to recover and what does the new future for our economy look like, because New Mexico's taken a 1-2 punch, as I said during the special session. Other states didn't have an oil collapse that impacted their finances and their economy like New Mexico, and we had that plus COVID. So we've got, double the effort that's going to be needed to come out of this. So looking at unemployment rates, both nationally and within the state, very high. Next slide. There's a series of dashboard indicators that we could collectively be looking at over time and thinking about the kind of strategies that we're deploying from a public health standpoint to our economy, and trying to blend those and doing more cost-benefit analysis about decisions we're making, and that will be really necessary as you go into the session. So small businesses open compared to the national average, New Mexico's way low. Percent of small business revenue changes, job postings, consumer spending, all of these, active rigs down 53% at the time that I made this slide. Sunport passengers down 75%. That's further contributing to what Dr. Peach talked about with the little purchasing of jet fuel. So with that, Mr. Chairman, I'd wrap up to say that, again, there's constant change in what we know and how to approach this particular issue, but there's a need for broader understanding of what we do as a state from a public health standpoint, but also from an economic standpoint on how we try to approach this 1-2 punch that we've been dealt with COVID and the oil collapse. Thank you, Mr. Chairman. Happy to answer any questions.
Representative Lundstrom.
Alrighty, thank you. I'd like to thank the presenters also. I had just 3 things briefly, Mr. Chairman. The first is, this is for Dr. Fitch. I'm very interested, Dr. Fitch, in your page 2, particularly the line regarding focused on testing and self-screening, and what you've done in helping the state. I'd like to ask if there's a possibility that you might be able to help us as we're looking at our next 60-day session. I'm not sure, I don't have a clear understanding of how that's going to happen, and it seems like you would be someone that would be able to help us, so I'm reaching out, and we'll have staff follow up to see if that's a possibility. I don't know what the plan is for us in terms of meeting in a 60-day session. Secondly, Mr. Chairman, I wanted to ask just very directly to Dr. Scrace. I'm having trouble reading the chart that you presented, and even up on the wall. We'll ask the staff to provide a bigger org chart for the New Mexico Medical Group, but in my opinion, Dr. Scrace, there's nothing about science and medicine in terms of recovery that's done in a silo. When we're looking at, particularly at developing our recovery system. So I'm going to ask you just very directly, would you include a representative from public school administration and an economist to this group? You've got a very elaborate and very distinguished group of science and medical people here, but I'm going to ask you point blank if you will include a public school administrator and an economist. And then lastly, I wanted to mention regarding the comments Dr. Peach made, understand when there's a request to make serious investments, that it's counterintuitive for me when we also say in the same presentation, serious revenue projection issues. So those don't collate for me, Dr. Peach. So when we talk about that, I understand that it's a need for serious investment in things, but we also, you know what the revenue projection looks like. You know what that's built on. So serious investment to me isn't just one-time capital here and capital there. It's an ongoing investment. So with those three comments, if anybody wants to comment, I'd be happy to listen to it. But those are my three comments on this morning's presentation, Mr. Chairman.
Dr. Scrace, would you go first?
I'm sorry, did you call on me?
Yes.
Your audio cut out.
Yes.
Okay, yeah, I mean, the MAT is really set up as a scientific group. They don't make policy decisions or economic decisions. That feeds in. I already texted John Bingham on about adding an economist to the Economic Recovery Council, but we would be happy to have anybody who wants to join and help with the efforts. It's just that we don't have them do anything policy-wise. And we do, actually, when making recommendations about school reopenings, of course, we involve people from PED and schools in order to make sure that whatever it is that we're saying based on scientific evidence is something that they can use. So part one, happy to do both. Actually, part two is already happening. Thank you.
Mr. Chairman, on that, I'd like the staff to follow up just so I know who those people will be to serve on that advisory group.
Mr. Chairman, would you like me to respond to Representative Lundstrom's comments?
Yes.
I do know what the revenue projections are. I've been following that for about 40 years. But there are ways to do this, and let me have some investments, and let me mention the word that no one wants to hear. We need additional tax revenue for two reasons. One is the instability of the oil and gas industry that we've had forever. When I first came to New Mexico in the early 1980s, that was being discussed before this committee and before Senate Finance and other committees. We need to have an alternative to oil and gas revenues. In terms of investments, there are all kinds of things that we can do. The gasoline tax has not been raised since 1993, and that's a per gallon tax that supports mainly roads. And, it's high time. 18 or 19 other states did this last year. It is high time that we raised the gasoline tax. Yeah, I have the liberty of saying this because I'm not in your position, and I know what tax increases are. We could tax plastic bottles. We could raise the personal income tax, which I think we are. New Mexico has virtually no property tax compared to our surrounding states, especially Texas. And if the investments are required, and I think they are, we're going to have to raise taxes. I hate to say that, but I know that tax is a four-letter word that shouldn't be used, especially before the legislature, but we need to do that. Thank you. And I hope that addresses at least part of your question, Representative Lundstrom, and good to see you.
Dr. Fitch?
Yes, thank you, Mr. Chairman, Representative Lundstrom. Our testing lab, since it's to end up in March, April, has done that in collaboration with the state public health department as a CLIA registered lab. That's been coordinated. We have one time also provided support directly to the state at the state's request. We'd be happy to look into supporting other activities with the state in coordination with the state labs. Thank you.
Alrighty, well, thank you, Dr. Fitch. I appreciate that. I just think that this is something where we're going to need some help for this next 60-day session. We're trying to make sure that we can meet the needs of the public and the responsibilities we have as a legislative body. And as a volunteer group, basically as a citizen legislature, we don't spend every waking hour worrying about that. And I sure would hate to come in here a few days before the session starts and we're bungling to try to figure out how it's going to work. One final comment on the tax issue, Mr. Chairman. I think I've got some concerns about that, especially when we see where our business economy is right now. When we look at the high number of people on unemployment and what have you. I don't know when a good time is to really dive into all of that, but I do have some concerns. Thank you, Mr. Chairman.
Representative Anderson.
Thank you, Mr. Chairman. I will try to be brief because I know we're under the time gun today. My question, Mr. Chairman, to Charles is related to your analysis of what I call the MAT process. MAT, I think there were 11 subcommittees. How many meetings has there been of MAT and the various committees underneath? And I don't expect you to have the exact number, but since March, when we created MAT, have they met a lot, a little, seldom, often?
Mr. Chairman, Representative Anderson, I would put that in the often category. I've been actually pretty impressed. The state did have a plan, and this was part of it, and they deployed it very fast. The state set up, with our fragile healthcare system, we had a higher risk population for this disease, and a higher risk because of the fragility of our healthcare system, particularly our hospitals. And I was very impressed with the folks that they brought in to quickly set up a system to be able to manage what, at the time, we were worried about was an overwhelming number of patients coming into the system. They're an advisory team to policymakers. So there's a different set of actors outside of this group that ultimately take their advice and make the decisions that you're seeing today.
Thank you, Charles, for that. And how would you rate their transparency from start through today?
Mr. Chairman, Representative, from the public's point of view, they're outside of public view. And so I think as this pandemic continues over time, it goes from a crisis team that has influence over what's happening, and as folks start to, we've all become experts in what to do about COVID thanks to Twitter, Facebook, and, the opinion news channels. And so over time, to continue building confidence, that may be something that they want to consider. I mean, the policymakers have had routine, regular public press conference about, the governor, about why she's making decisions and what they're doing. It could be helpful to see what's feeding into that.
Thank you. Thank you. My next question, Mr. Chairman, is to Dr. Scrace. And it would be, Dr. Scrace, as we were dealt this hand, COVID-19, earlier this year, and we look back at your leadership of the response to date, I was curious, sir, what you would identify as one of the accomplishments that have been accomplished under your leadership in this short period of time. I don't need all of them, but I was really curious what would come first to your mind.
Mr. Chairman and Representative Anderson, great question. Thanks for that. I think if I were going to pick one thing that I'm most proud of, it's our ability to organize the number of people we have organized and bring them into sort of a partnership relationship under the medical advisory team between government and the private sector. I think that's leveraged the state's ability dramatically to address this pandemic and to move and be nimble to go from place to place as geographically the pandemic has changed, as scientifically we have more information. So I think building the team that we've built and all of the reports from the MAT, everything that the MAT, weekly presentations from the modeling team to every single report that I showed in the slide earlier, every bit of that is available on the website. So it's all of those documents are open to you, to the public as well.
Thank you, Dr. Scrace. Mr. Chairman, that really brings me to my final question, which is a question relative to the Economic Recovery Council, whatever we're calling them. My question, short answers, please. Charles, do we know how often they've met? What was their first decision? And secondly, how often do they meet?
Mr. Chairman, Representative Anderson, I don't know either of those. I can't answer that.
Thank you, Charles. I suspected that was going to get a non-answer. They're paid per diem and mileage. How many days of per diem and mileage have been paid? Do we know that? That's certainly a public record.
I don't know that, but we can follow up.
Thank you. Mr. Chairman, my personal observation is that once the Economic Recovery Council was formed, it took 2 weeks for them to make up their mind that they would only meet in secrecy. Now, secrecy is code words for zero transparency, in my opinion. We listened about Matt and some of their non-public activities and meetings, but nonetheless, there is a great outpouring of public data that comes from that. My question is, why do I never see any data? We know nothing. The second thing, a month later, they decided on what their seal would be. Now, that's the seal that goes on their official activities. Well, boy, we're making progress. And as a New Mexico State University trained economist, I would say that is a measurement of not much progress in that period of time. Lastly, we talked about, Dr. Peach mentioned, he mentioned the need for a measurement. We have many measurements and gating criteria under the medical side. What are those under the economic recovery side? Are we aware of any such, what is their goal? We don't know when they meet. We don't know how often they meet. We have no record of any decision except their seal and their secrecy. And I find that upsetting, and I'm looking forward to getting more answers than we're going to get today, because today we're only hearing from the medical side. Mr. Chairman, thank you.
Senator Kernan.
Thank you, Mr. Chairman, and thank you for the presentation. I need some clarification with regard to the testing, and I believe it is on slide 15 in the document that we have. And I think if Dr. Scrace would look at that and the part about testing capacity, general and targeted population, so the number of tests per day as it relates to the 7-day rolling average. So I think in our previous conversations, Dr. Scrace, we talked about the need for more testing basically would help a particular community meet that gating criteria with more testing. When we have low testing, like Lee County, makes it more difficult to meet that gating criteria, and I think that's kind of what this is saying here. If we have more testing and we have more people test negative, and we'll have some more positives as we test more, but would that help with regard to the gating criteria?
Mr. Chairman and Senator, great question again, and we have talked about this, Senator Kernan. Last week we explored the question as to whether or not, as we were told by folks in the Southeast that they're getting most of their testing done in Texas. We looked at turnaround times for getting results back from Texas, but because they're done by established labs, most of them are electronic and most of them come pretty quickly. The mathematics of the test positivity rate, when applied to your question, the answer is it depends. If folks are let me think how to say this better. The test positivity rate is just the ratio of cases to total number of tests. So we deduplicate the numerator in that. I think we've seen, as you saw in that slide, all the way from 37% of people in McKinley County tested to, and I probably can't do this, Harding with 7.2%. Even DeBaca, that's only had one case, has 18.3%. So I think what we're looking for here is for community participation. I was on the phone with rural hospital leaders on Wednesday talking about how they could partner with DOH to do focused testing events in these counties that have high test positivity rate and have high case counts, what we're calling red counties. We just talked about that this morning at our daily operations meeting, and DOH is looking at a number of solutions for that, but building a stronger public-private partnership. And then I think also messaging from community leaders in those counties is going to work a lot better than messaging from Santa Fe. So the extent to which you and school leaders and city mayors and county commissioners can be strongly advocating in your own locality that people get tested, my belief is that will have more positive effect on raising those numbers than anything else we can do.
Thank you very much. And so the answer is yes. And that's what we've been doing in Lee County over the last couple of weeks with a plan to increase testing. But I want to make sure, and I think what you're telling me and what I'm looking at online under gating criteria with regard to the website you directed us to, it clearly indicates that that would be the case. So that we're going to move ahead with that because we're really, really determined to get out of the red, and we think it is testing that's going to make the difference. So you're telling me yes, correct?
I think what I'm saying is the number one step when you're a red county is generally to do more testing. You might actually see an increase in the number of cases initially because you're going out and testing a lot more people. And sometimes in an initial push, folks who live with people who are COVID positive or work with people who are COVID positive may be the first ones to come in and may be positive. But over time, with a sustained increased testing strategy, every place else we've looked at this, we've seen the results eventually come down and get back into that green range.
Thank you very much, and that leads me to my next comment or question, and we've talked about this before, that 58% of our employees are considered essential, which is a high percentage related to the rest of the state. And we know a lot of that is related to the oil and gas industry, where they're back and forth between Texas and New Mexico. We're not going to shut down the oil field. We're going to keep doing what we can because we know New Mexico needs that investment. So 58%, and I wanted to ask Dr. Fitch very quickly, because there are a lot of people on this list, is there any consideration whatsoever in your formula that accounts for the fact that some areas of the state actually have a lot more people out working and are required to be out working because they're essential? And so when you look at a county like Lee or even Eddy, and such a large number of those individuals are essential and out working from the very beginning, is that part of your modeling?
Several of the models do incorporate time outside the home, whether that's for work or other things, yes.
And so the 58% number for Leonetti County, do we get any break at all with regard to that high number of essential workers? Could that potentially be impacting the fact that we continue to be in the red?
I wouldn't know off the top of my head. I'd have to go back and have folks look at the data itself.
That would be very helpful, and I would like that information. I also want to ask about location of testing. We have a lot of companies that are Texas-based companies, and when they have an employee that needs to be tested, or numerous employees, and those employees are directed to go to Texas for those tests, and I'm assuming that Texas reports back the positives of those tests that are done in Texas, but they're New Mexico residents. Is that correct, Dr. Scrace?
Yeah, Mr. Chairman and Senator Kernan, I mentioned that briefly earlier. We researched that last week, and we are getting both positive and negative results from Texas laboratories for all the tests done on New Mexicans.
Thank you. I wanted to confirm that the negatives are also included, so the number of tests given, we're not just getting the positives back, correct?
That is correct.
Thank you very much on that. Yesterday, we had a really impressive conversation with superintendents and from the Superintendents Association, and I'm wondering if the medical advisory team, and I still don't know who that is because I tried to pull it up online. It does not really, I couldn't find the chart. I can't read the chart in this publication, so I don't know who that is, but that presentation was really alarming to me, and I wonder if the medical advisory team has read the letter that the Superintendent Association sent to the Secretary of Education, Dr. Stewart. And this is Dr. Scrace. Have you all had a copy of that letter presented to you or received a copy of it?
Mr. Chairman and Senator Kern, I believe that I was copied on the email about that letter. Again, I'm not sure which presentation you're referring to, and so that's where I'm all tripping up here.
Well, thank you very much. And so the letter, Mr. Chairman, was sent from the Superintendents Association to Secretary Stewart. And my question was, did you all, as part of the medical advisory team, also receive a copy of the letter outlining some real, I think, very important concerns with regard to reopening of schools? And so I think it's really important that everybody gets on the same page. And so we have a group of superintendents representing all of our districts, and it was a unanimous letter that was sent. We need to make sure that everybody is on the same page, and I've asked the chair if we could have a joint panel at some point in the near future, having the medical advisory team representatives, the Superintendents Association, and the Secretary of Education come together, because we have grave concerns about the fact that schools are having great difficulty with reopening, and I don't want to get into that now. I think that requires a separate hearing, and I would certainly hope that your group would participate, and I do encourage you to get a copy of that letter that was sent recently by the Superintendents Association, because I think there is a lot of concern, and if you're interested, you could actually go back and look at the archived presentation that'll be on the website of that meeting that was held yesterday here at LFC. And I think that would give you a little bit of a head start and some information on what those concerns are. But no need for a response on that, just an encouragement on the part of the medical advisory team to take a look at some of those concerns, which I think I have learned today that the medical advisory team just looks at the science and then relays that to some policymakers, and I'm assuming that's the governor and her team, I don't know, but it appears that everything that's being done is based on what the medical advisory team tells that policymaking group. And so, okay, great.
Mr. Chairman, can I just briefly comment? What you said at the end, Senator Kernan, is exactly right. So I did get a copy of that email. I don't have it in front of me right now. What I would do would be to extract any additional scientific data or concern about data that was expressed by the superintendents and have the medical advisory team look at that. But they really only advise on issues like safety. Secretary Stewart, governor's office, and others take those recommendations and figure out how to operationalize them. So I'll go back and look again. I don't recall it, my first review of that letter, that there were new articles sent or new concerns being sent about the way we were calculating the numbers. But that would be strictly the role of the medical advisory team. And we do make recommendations, and not every single one of them is followed. So that just is the fact of how it works.
So thank you very much, Mr. Chairman and Dr. Scrace, for that information. And I agree, maybe it's not the medical advisory team that we need to bring together, but the policymakers at the governor's, within her executive, maybe those are the individuals that we need to make sure that they are hearing the concerns. Because when I talk to Dr. Stewart, Secretary Stewart, his response is always, we'll take that to the medical advisory team. So I'm not sure where the decisions are being made. I do know that the decisions that are being made have caused concern, I think, from not only myself, but from others in this particular body. But we need to work on that. Let me think. I do have one other comment with regard to hospitalizations in Leonetti County and Lee County in particular, which is red. I check with my hospitals every single week, and I ask them about admissions, I ask them about transfers, and I ask them about people coming through the emergency room. And even though we're in the red, the latest report indicated that over the past 2 weeks, we've had 4 admissions. We had 3 people in the emergency room that were sent home, and we had 2 transfers. But yet our schools are shut down. So I'm not sure if we're looking at the right criteria. I know a lot of people are getting COVID, and some are doing not doing well, and many are recovering very quickly, and life goes on. So we've got to begin to balance what is happening to our children in our school systems in New Mexico with the science with regard to the spread and COVID. We've got to have a better balance. When we go across state lines in Seminole, they're all back, all in. Lubbock, all back, all in. Andrews, all back, all in. Our people are leaving. They're getting their kids enrolled in other places. So I'd encourage you and whoever is making the policies to look at yesterday's LFC meeting and look at the superintendent's letter. And that's all I have. And thank you, Dr. Scrace. And I always appreciate the fact you've always said you're willing to meet and talk with me, and I think that's a very important thing, and I've always appreciated that. Thank you very much.
Munoz.
Thank you, Mr. Chairman. And Dr. Scrace, I just have a few questions for you kind of quickly before I ask the other presenters. Dr. Scrace, I mean, there's a new testing out there, and I think it's an antibodies test where you draw your blood, and why isn't the state moving into that self-testing, antibody testing? I think Abbott Labs came out with that. And why is that not good for people that, and I'm saying myself as an employer because I had a chance to get some and I got some, and so I could test my employees at any point in time when they walk in and they say, oh, I have one symptom of COVID or something, so then we make them self-test immediately, and if their temperature's high, they automatically got to log that in and wave that in. Why are we not moving to some self-testing within the state to keep people safer?
Mr. Chairman and Senator Munoz, great question. There is actually pointed to at the document about the testing, various kinds of testing. I'm going to go out on a limb here, and because I'm almost certain that you meant antigen testing, not antibody testing. There would be no place for using antibody testing whatsoever for someone who is acutely symptomatic. So hopefully you bought those antigen tests, and those are the ones that you're using. Antibody tests take 7 to 14 days to turn positive. And so we are looking at, there's a lengthy paper on antibody tests online, though. With respect to antigen testing, I do think there will be a place for that. The problem is the rapid antigen tests only have a place with testing symptomatic individuals. They can be quite accurate if we use it for symptomatic individuals. We've received a number of machines from various resources, federal government and others, sent to nursing homes to use antigen testing for asymptomatic people, just screening where they have no place at all. The test is not accurate at all when people don't have symptoms. But we are looking at this. We are testing. We're looking at options for doing more antigen testing. I think it has a place. The rapid antigen tests that have come out so far, there's only one EUA for that, and it's the Abbott that you mentioned, and the Binax, and that one very, very strongly worded approval from the FDA to only use in symptomatic people. So we are looking at that. We're looking at ways to distribute the testing we're going to get, but in the end, it will only be used for with people who have active symptoms. Also remember that somewhere between a third and almost half of New Mexicans who have had positive tests did not have symptoms at the time. And so that's part of what we're building into the equation as well. But we're very interested in that. We think the rapid turnaround will help. I hope that the testing you're using involves a machine and not just a paper strip, because the paper strips are even less accurate, even in symptomatic individuals. Thank you.
Thank you, Mr. Chairman. And Dr. Grace, I did say the wrong term and you said the correct term, and they are a tray, and you draw your blood like a diabetes test and mix it with the other thing. But I think for us in McKinley County, I mean, you know what we went through and the state team we went through. The problem that we got to resolve in McKinley County for us is how do we isolate people? And how do we isolate people on the Navajo reservation because they live in close proximity to each other and in groups gathered around there with their family. And so that's a bigger problem for us if this happens to come back. The other thing that I'm really disappointed in the state and what the state has done is it's good for the people, but it's bad for New Mexico's numbers, is we fly people in and out of Arizona into New Mexico, into our hospitals. And I know that for a fact because I see the flights at the airport. I see them unload them, load them back up, and they're off to Albuquerque. I talk to the pilots, where they're going, where they come from. So I just wish we could separate some of those true numbers out of Arizona from New Mexico's true numbers. I live in an air flight pattern, and there's probably still 4 to 5 helicopter flights a night out of Gallup, and plenty other planes. I don't know, probably another 5 planes a night. So we have a high level of air traffic being flown back and forth. It hasn't seemed to slow down to me. But I think that the next thing I want to ask you, so when we take a COVID-19 test, what happens to the test afterward? Is the sample kept? There's no DNA testing. How is that person tracked from there on in their healthcare? Does that go in their health file? Does it, because the question becomes is, for us in business, and I'm going to talk about this in economic deals, all of a sudden they're going to start tracking where that person was and what business was he at, and how many people were exposed, how many people wasn't exposed, and the trial lawyer is going to come in and say, here's the liability. So what's happening with that test when it's done?
Mr. Chairman and Senator Munoz, all great questions. Extremely briefly, we have housed hundreds of Native Americans in Gallup, so they didn't have to be at home with COVID in their multi-generational homes, and that kind of housing continues to this day, with Gallup being the number one number of overnight stays that we've had for isolating COVID patients. We looked a couple months ago at that, July it was, about importing and exporting COVID, and the numbers are almost identical. We have as many people who come into New Mexico hospitals from border towns outside of New Mexico as we have people who live in New Mexico who go to out-of-state hospitals. And you heard Senator Kernan mention a number of the cities like Lubbock where people go. So we are neither an exporter or an importer of coronavirus hospitalized patients. And we do monitor those transfers every single day, every morning at 7:15, weekdays now. And then lastly, what happens to a positive test? Those results go to the Department of Health. Whether or not they're included in a patient's medical record would depend on whether or not they were actually, had their test done within their medical home. If you went to your like a respiratory clinic at UNM and you were a UNM patient, it's possible that could be in your medical record. Contact tracing is tough though, because it is hard. If every person who got COVID had only been one place in the previous 14 days, we wouldn't have a pandemic, but they've been a lot of different places. And so just the statistical ability to track that down is very difficult. We do post rapid responses in businesses online through the environmental department, but to my knowledge, there's no tracking of that information, but it does highlight the real sticky wicket I think that DOH is in when we try to limit the amount of public information we have that could be traced back to a single individual, the trade-off between that and full transparency. And so I think the DOH does a good job walking that line. We made a mistake early on with a patient in a small town who was admitted in the hospital and died from COVID, and everyone knew who that was once they saw there was a death. And so it's tricky, but with respect to your specific concern about whether specific employers could be held more liable based on the data we're holding now, I believe the answer to that is no.
So, thank you,
From a
Mr.
time
Chairman.
management standpoint, we've got 5 people on the list. So we need to shorten our questions and our responses. Thank you.
Thank you, Mr. Chairman. So Dr. Scrace, one more thing. Inside the schools, when they have a kid come in and when they open and take their temperature, they're automatically required to put them in a room with a teacher. And so now that teacher is going to be exposed to COVID, or they have to have a volunteer. And in McKinley County, my wife is a principal and said, "Oh, I want to assign a teacher." No teacher would take the assignment. No counselor, nobody would. And so then she said, "Let's get a nurse to manage that room," and they wouldn't send a nurse. So now you're in the position to put somebody in the room with a child to monitor them if they do have that. So you're going to have to fix that in the state of New Mexico. You're going to have to get with PED and fix that, because no one's willing to put themselves at risk. And the PED has required them to monitor that child when they have come in with a high temperature. So that's something real quickly. I want to make sure everybody in the committee and everybody that's listening knows the most important thing that I think you can watch, and it was in Charles's presentation, it's called the Economic Tracker. And it's done by a group of Harvard guys and I forget the other college they're from, but it tracks every state's recovery, unemployment, employment, jobs. You can track it by county. It's probably one of the greatest tools that you can watch and at how we recover. But it's so important for business people, or for me to watch that. That came out of a business group, to watch that tracker and what the trends are in New Mexico compared with Arizona, Texas, Colorado, and your surrounding states. So I think that's very important. There's absolutely no way, and Dr. Peach said raise taxes. There's absolutely no way right now a business can accept any tax increases. Personal tax increases will make us move wealth out of New Mexico. Business tax increases right now will make us move out of New Mexico. We will become out-of-state companies with in-state presence in New Mexico. If you start driving taxes up in any way, shape, or form in any type of the business world, GRT, payroll taxes, we will leave the state. I am an employer who has hiring employees right now just because of the business I'm in. And for us to monitor and check employees and what used to be clean vehicles is such a burden and a cost to us daily that people cannot do that. We are still operating at 25% in restaurants. There's no way you can make 100% of what you made operating at 25% more. You are borderline survival with minimal strategies to keep your doors open and not a lot of net income on the backside. The Recovery Council in the governor's office, people have left that because because everybody said it is already prioritized what they want to do, and there's no input on how we recover in New Mexico. I personally believe that there is no business, a few business people that have input, but it's not taken anywhere in that council. And so they have already set up what they wanted to do, and they're not tracking the economy in New Mexico. The two most important jobs in New Mexico are Dr. Grace's with the virus and economic recovery. We have done a horrible job in New Mexico with economic recovery and helping businesses. Oh, sure, go rent a tent, put it outside, but then block the tent off so there's no air circulation, which is the most important thing that can happen in COVID. So the economic recovery and economic things that the state thinks they're doing for business is really not working. I see it in my community every day and hear about it. So I think that New Mexico had better get on the economic recovery in a hurry. No matter what stimulus money comes in, it's those small businesses, from the food trucks to the bricks and mortar buildings that drive this economy. And we better figure out how to get them back open and running, or we're going to be in worse shape. Thank you, Mr. Chairman.
Representative Dow.
Thank you, Mr. Chairman, and thank you for the presentation. Secretary Grace, can you tell me what percentage of the meetings that you're holding are choosing to follow the Open Meetings Act? I mean, I know the acts in which they're being created under the Public Health Act, the Hazard Emergency Management, Public Health Emergency Response, doesn't require it. They're so old. But we as a body, and seems the executive's in agreement because she signed the bills for open meetings, what percentage of those are open to the public to at least observe?
Mr. Chairman, Representative Dow, I think when I first got started in this, it was under the aegis of DOH. And so we're just operating under the DOH approach to doing this work in a closed fashion. I'm a very transparent person. I bring as much data as I possibly can to the table. We have a lot of discussions about individual hospitals or even sometimes patients, and I think that there is wisdom in allowing those conversations to occur without revealing the names of hospitals or doctors or individual people with COVID. So the answer, to my knowledge, is zero, because we're doing these frequent daily meetings in a that involve protected information.
Thank you, Mr. Chairman. And on those economic recovery or those other type of committee meetings where we have business members or non-government employees that are providing input, you had sort of alluded to Chairman Lundstrom's question that people could participate, but they wouldn't have policy input. What percentage of the people participating in all these created, there's early childhood ones, there's school reopening ones, do they have policy input or they are just advisory?
Mr. Chairman, Representative Dow, I don't know if I'm the best person to answer that question. I don't oversee any of those groups. I show up at many of them to give updates on COVID. I hear the discussions, and I need to defer that and promise to get that to the right person and have someone get back to you very soon on that.
Thank you, Mr. Chairman. And I noticed in Charles' presentation that he said that there's varying guidance for reopening based on the source. So one could suggest that you can just pick the guidance that matches your preference on opening or staying closed. So I specifically want to know the scientific data that's allowing teachers to determine if their classroom opens. Were those teachers given some sort of guidance? How did these teachers who have a degree in education receive the information they needed to make a scientific decision on whether their individual classroom should open or close?
Again, Mr. Chairman and Representative Dow, I'm going to have to defer that question to Secretary Stewart. I don't know what the flow of information is after we send it to him and to governor's staff. So I would say I don't know that we're asking teachers to make scientific decisions. I know that the gating criteria we use does set up a series of criteria to judge the best we can based on the evidence, the safety of reopening in a community. And then I think schools have the option, districts have the option of reopening after that. And we know that less than half of districts who have the capability of reopening have done so. How that plays out in an individual school, I'm completely unfamiliar with that.
Thank you, Mr. Chairman. Thank you, Secretary. It's difficult as, I guess I'm a layperson, my degrees are in business and early childhood, but it's difficult when we ask questions that seem, in the common sense world, they don't make sense, and the answer is always it's scientific driven. And so I'm just really trying to understand if that is the case. And I think Senator Munoz alluded to another one that just doesn't seem scientific based. You can have 25% inside, or you can have a tent on a concrete parking lot that may or may not be sanitized, and that can be at 75%, but it's completely enclosed and might as well be inside, but somehow that tent is scientifically safe, and inside it's not scientifically safe, and I don't have a degree or the gating criteria that you had that allowed that decision to be made. But I guess I get my last question. I have a ton of questions, but for time's sake, I heard that we're asking for, I think it was Dr. Peach to give some recommendations for us for revenue enhancements, and I understand that there are different tax policies, and he made it clear that his recommendations are tax increases. I'm just wondering if this committee could also hear from people who believe that tax cuts would also grow the economy. I know there's different tax policies, particularly when it comes to eliminating retirement income, or eliminating tax on Social Security income, or on veteran benefits, because we are about to, as a nation, have that senior citizens will be the largest population in the United States for the first time in the history of our nation, and we have all the opportunities to attract retirees, the largest growing population in the nation. And I've seen tax policy that shows if we would choose to eliminate Social Security income or retirement benefits, that we would be competitive with our neighboring states like Colorado, like Arizona, and we would actually see revenue increases as a result of cutting taxes. So I'm just wondering if we could have multiple perspectives on tax policy versus just one who's indicated tax increases are the only option.
Representative Armstrong.
Thank you, Mr. Chairman, and thank you all for your presentation. One of my biggest questions and one of my biggest concerns, as everybody hears me beat my rural New Mexico drum, largest county in the state that I represent, which is Catron, with 9, I believe now, maybe 11 cases in 7,000 square miles. And I just want to know if Dr. Scrace, if your medical advisory team was involved in changing from occupancy versus enrollment in schools?
Yeah, I'm deliberately pausing here, expecting the chair to explain to you why I can't address that specific question today.
Okay, I get that, but okay, I understand that. Thank you. My apologies for that. But I just need to make sure that all the listeners and everyone knows that when you have a capacity of 300, enrolled around 90, and only half of those kids can come back to school in rural New Mexico that travel an hour or more to get to school, just the common sense is out the window. One of the other questions that I have, Mr. Chairman, Dr. Scrace, is, again, with the common sense part of it, is childcare can be 20 and with 2 adults where schools cannot be. And so I just wanted to, everyone's made really good points in here, Mr. Chairman, and we all represent different areas of New Mexico, and we just want fairness, and a lot of the people that I represent feel that everything has been very unfair. I know it's a tough job, and I do appreciate how open you've been with myself and others in this body, and always willing to meet, as Senator Kernan stated, and I appreciate it. And the job's not easy, Mr. Chairman. The job's not easy for any of us. You're boots on the ground, we're all boots on the ground, and I agree totally with Senator Kernan. I would love to see everyone on the same page, and we have so many different, the goalpost keeps moving, and again, common sense out the window. We expect our people, New Mexico, to do certain things, and then the goalpost is moved again. And so we're just out here working our tails off, trying to figure out how to save New Mexico and save our economy and keep our grandkids and our children here in New Mexico as they're getting ready to throw up their hands and say, forget it, I'm out because I can't take the goalpost moving anymore. Businesses, I have grown men that I run into in Walmart or my little local grocery store, and they're begging me to do something. And once again, common sense would be helpful along with the data, but some common sense in perspective to areas of New Mexico. And so that's all I really have. Thank you, Mr. Chairman.
Mr. Chair and Representative, just very briefly, I know sometimes things don't always seem like common sense is being applied, and sometimes the explanation for that is just a lack of information. So it turns out that we are treating schools exactly like we treated childcare. They started with 5 students a class. We saw how that went. We did a lot of testing. We saw a relatively small number of cases. About a month later, we went to 10 students a class. And then 6 weeks later, we went to 20. And so sometimes if you're comparing things at different points in time, it might not seem fair, or as you put it, like anyone's using any common sense at all. But sometimes there's actually a methodology that is being used behind the scenes that just isn't apparent. And then on the goalpost moving, I'd be happy to talk with you about that more. It's not my impression that there's been a lot of that. I think we've had some fairly stable criteria. We did add 2 based on scientific data, but I will reach out to you offline on that point.
Thank you. Senator Woods.
Mr. Chairman, I'm sorry for the slight pause. I just want to brag on Dr. Peach. He stated the very obvious here, that this is a one-time occurrence on our financials. We can't take this as being good news long term. Yeah, we had a spurt in our economy, but we've got a lot of people out of work, no jobs to go to, and we got a serious problem here. And we've got certain segments of our economy that are doing well. We've got the testing segment, testing the very COVID virus. Those guys are doing great. You might ought to look into those and put those on your list of people doing well. We've got hospitals that are now turning around, now that we have other patients coming in, because we never did fill those hospitals up with the ones we thought we were going to fill up with. Yeah, I still have problems with the modeling. It's not a perfect deal. Mr. Chairman, I know the time is late. I thank you for the opportunity to speak. Thank you very much.
Senator Gonzalez.
Thank you, Mr. Chairman, and the same, I just have a couple of things and more of clarification, but thank you to our panel and presenters, but I guess it would go to Dr. Grace. If someone is tested positive and they have self-quarantine and they recover, what's the next step?
Mr. Chair, could you repeat that, Representative Gonzalez? If someone's tested positive and they have what?
Well, Mr. Chairman, basically what I'm getting at is that we always get the report, and I'll use Taos for an example. Right now, we're showing that there's 144, but we never show the recovery number.
Yeah, thank you very much, Mr. Chair, and also Representative Gonzalez for repeating that. Yeah, we've talked about this at a couple press conferences. The way I think about recovered cases is it's really the total number of cases minus the number of new cases we've had all added together over the past couple weeks. But we initially thought that everyone recovered from COVID within about 14 days. Now we know that somewhere around 15 to 22% of people have a more prolonged illness that would keep them from returning to the workforce. So we do not have the system by which we report recovered cases relies on the Department of Health actually making a contact with that individual who tested positive 14 days later or somewhere in that neighborhood to confirm that they are recovered. And so now they've changed that way of doing it to automatically reverting people to being recovered after I think it's 60 days, because it's just when you're better and you're can go back to work according to the requirements people do, we have a hard time getting a hold of them on the phone. So I think that the vast majority of people are recovered. It's just the cases in the past 14 days that I think of as being the ones who can infect others.
Mr. Chairman, I'm just seeing that for my part, and we try to work as much as you met with, as far as you mentioned, community leaders, commissioners, and others in our area, is that we talk about the using of a mask and then the distancing, and to me, it would be more positive, for a community to see, yes, we have 144, but 78 have recovered. So we are doing a good job, so let's keep it up and let's even do it better. And so we never see that part, and I think that it always leaves like a blank, well, what happened to this 144 persons? And I think if there was a way that we could come back, and even if it's 60 days, to let the overall information, as you mentioned, transparency, well, we are doing a good job. I think it would reinforce, again, the ruling of, what we're doing with wearing a mask and also being distant. So that is my thought, Mr. Chairman.
Additional questions? I want to thank the panel. On a positive note, Dr. Fitch, God, we're lucky in the state of New Mexico to have Los Alamos Labs. We appreciate your scientific and technical support for this and the modeling that's taking place. But oftentimes when we have hearings such as this, we certainly communicate and encourage and act as a catalyst for the state of New Mexico to find out what's wrong with the state. When in fact we have resources out there that maybe we don't call on often enough, and from that standpoint, but Dr. Fitch, as a New Mexican, I am so proud to have the Los Alamos Labs here in the state of New Mexico on that, and appreciate the input to our committee. Dr. Grace, I can go home to my coffee club and I will have a multitude of opinions on what needs to be done. I jokingly say that the more of us that are participating in that coffee club, of course, we're all wearing masks and we're using the distancings and everything, and IQ-wise, collectively, maybe 100 if there's 10 of us in there. From that standpoint, but it's very, very difficult when people are coming from different directions and putting everyone on the line trying to get a response. Those of us that live along the Arizona border and the Texas border certainly have a different take from those of us that live in Santa Fe, New Mexico, or in Albuquerque, New Mexico. It's always a little befuddling when we talk about outcomes for public education and we find out, like in Albuquerque, that the school board has no authority. Quite frankly, it's AFT that is making that determination on what needs to be done and what shouldn't be done. And they probably have some outstanding people there, but from a scientific and technical support situation, I'm not certain they're qualified to have say in what we should do and what we shouldn't be doing. I do believe, though, that with what's going on here in the state of New Mexico, that there's got to be more local participation in some of that decision-making process. You reach a point where you can be hunkered down for so long, and pretty soon you get a rebellion from the people. So somewhere that balance has to be achieved. To achieve that balance, local school systems and local communities need to be brought into the loop even more than what they are. And so that's a huge challenge for the state of New Mexico. Dr. Peach, I certainly appreciate your input. We've been talking when we talk about taxes, and that's why I've been trying to couch my remarks about revenue reliability. With the system that we presently have right now, we can't make those investments in infrastructure. And what bothers me from a legislative perspective, we've moved into an era where everything is done by how well something polls. Because something polls extremely well doesn't make it responsible. When you look at a $7 billion budget and 40% is coming directly or indirectly from oil and gas, you're bumping close to $3 billion in our general fund. And if, in fact, it is abruptly interrupted from that standpoint, for those legislative members saying that we're going to not fund certain things, it's great to say we can go back and cut taxes, but pretty soon there's a law of no return from that. I think, and I don't think it's going to happen, that the executive and the legislative branch needs to be leading the charge on trying to phase in a redirection of our revenues through and encourage reliable revenue streams on that. And yeah, that's going to be painful, but if it's phased in, you take some of the edge off of that. And I think that could certainly be done, but I don't think it's going to be done. You're going to hear a cry in January, well, my gosh, you got a 29% reserve. You're going to have to spend more money over here. But we don't know how long this is going to last, and we know we're in a change that's taken place. Now, I don't know whether it's the biggest change from the Stone Age to the Iron Age, but there's a huge change that's going to be taking place in the state of New Mexico, and New Mexico is going to have to be more nimble than what they are on that. On the oil and gas side, individual that you well know communicated to me that a pretty pessimistic outlook for fossil fuels, not just in the state of New Mexico, but for the United States. That individual said, you know, certain presidential candidates might speed it up, the demise, but the nation is on a course to, will probably be in a position because of the discouragement of extractive industries from an environmental standpoint, that we probably will be importing oil once again from that standpoint. And those people that applaud that have failed to step to the plate to tell us how we're going to offset this. And if we're not talking about revenue reliability, and in some cases maybe taxes, then we're not fulfilling our responsibility as a legislative body, and certainly you're not fulfilling the responsibility to the state of New Mexico. And we've got additional looming problems taking place, not just as a state, but we have to be cognizant of local government revenues. And we have either exempted or have failed to address certain needs in those local communities, and so it's probably going to be more apparent to us as a legislative body into the future once we go back to our respective districts and we find out that that we're going to have to do something about local government revenues. But we do need to make the long-term investments, and the Transportation Committee will be meeting here on October the 20th. One of the issues we're going to be talking about, obviously, on the gasoline tax, we need to come up with a way to make certain that the electric vehicles and the hybrids are paying a larger share than what they have been paying. I'm sending a message to Council Service. I've asked for that bill to be drafted, and I don't want any tax incentives in there for the purchase of those vehicles, because that's going to be happening anyhow from that standpoint. But those are areas that, Dr. Peach, I think you're probably looking at and saying we need to do something from that standpoint. We've obviously been spoiled by oil and gas in the state of New Mexico. But as their financial contribution percentage-wise is decreased through changing times, then I think we have a responsibility to try and mitigate that change as best we possibly can, and would hopefully make certain that the state is not in a convulsion mode, that we can make those adjustments and transition that over a period of time that would give the citizens of the state a softer landing than where I think we're headed right now. So I appreciate the presentation on that and the willingness to three presenters to step to the plate on that. So we thank you very much. I think we have the lottery up next. Well, that's appropriate. I think something was supposed to be under L, and you put it under there intentionally. I got excited the other day. I bought a lottery ticket, and what's the probability of having all the numbers correct versus having them all wrong? It's about the same, isn't it? Okay, well, that's sort of where I'm at. I've been very, very successful at having them all wrong consistently. So if consistency is a virtue in golf, it's not that way in the lottery as far as I'm concerned. So we're anxiously awaiting to hear from you.
Hopefully, much better. $38.1 million to the scholarship fund. The year before, we transferred about $41 million, so we were down approximately $41.3 million the year before. But we were down about $5 million with our transfer. But for any of the Powerball players in the room, you probably wondered what happened to Powerball. Last year, our jackpot games, which we have no control over, which you and I have talked about at great length in the past also, Mr. Chairman, we were down almost $21 million in revenues just from ticket sales on jackpot games. So obviously, that's very difficult to make up since it's a category that we have no control over at our lottery. We play it, and we're part of a national group, as you're aware. So during last year, we had a couple of jackpots for about $400 million, far from the $1.5 billion we've talked about in the past. So we had jackpot fatigue that really had set in this past year. So we always are working on the jackpot games, and I'll talk about Powerball and Mega Millions a little bit as we go through with this presentation. But we are trying to make some changes to the Powerball game, adding a draw, maybe even adding an international sales component to our game, so it'll help expand our base and bring in more players to the game itself, which is what the game needs. If you'd flip to page 3 on the presentation, Mr. Chairman, this is just an overview historically of since 1996 of how much money we've transferred by year. It's not uncommon to have a good year and then fall back a little bit because the jackpots that we talk about are not there the following year, and people aren't playing the jackpot games as much the next year. So that's just a summary, but if you would turn to page 4, I like to talk about what we did right, when we did it right, and how we have our maximum returns. And those factors that we pull out year in and year out and we analyze to see where we are. You'll see in 2016 we had a transfer of $46.3 million. One of the things that we did right that year better, the scratcher sales that we talk about also that we control, we sold almost $83 million in scratcher sales, which was the difference between the 43 and the 46. The 43s across the board are very good years, but the difference being the scratcher sales are not as high in those years as they were in 2016 when we had our record year. One of the things I like to talk about on page 5, Mr. Chairman, is where the money goes and how we actually budget every year. Most people that we come before in the legislature know about our 30%. So really, when we start our budgeting, we take 30% and we back out everything that we do to get the other 70% basically in the categories that allow us to turn in the 30% that are required pursuant to the statute. Last year, we had about 3.1 cent of our dollar bill actually went to administrative costs. That was down slightly, about 0.6% from the year before. The cost of our product actually goes up because one of the reasons I love the Powerball jackpot games is we don't have to buy a scratch ticket. Every time we buy one of those scratchers, we pay more. So I love the online games because they're cheaper. The cost of the paper and ancillaries are in our contract, and it never goes up after our original contract. Last year, our players received 53.7 cents in prizes, and that's probably low in the country. It's probably one of the lower in the country based on our 30%. It makes it hard for us to actually move prizes into that area since we have categories that are already locked down. The 6.5% that you saw on the prior page is what we pay retailers every year, and that's by contract. So there are things that don't change, which are contractual, that make it much harder to put money back into the prizes, into the games. On page 6, you'll see a budget summary, and it shows fiscal years 18, 19, and 20, Mr. Chairman. And you'll see fairly consistent. We were down in administrative costs this past year, about $1.4 million. But if you look across the board, you will see that as gross revenues go up, also our return goes up to the scholarship fund. So that is one of the reasons that we always talk about when players win more, students get more. I think a lot of times the students don't take the time to think that if the players don't play, they don't get their scholarship money. So we also have to keep the players happy on the front end so they do want to play our games. So we try to do that as best we can within our statutory requirements. But as you can see, fairly consistent years. If you would turn to page 7, you'll see, and we've talked about this basically year in and year out, our overall operating expense is always a little bit above 16%. So if you add 16%, 30%, you literally get pretty much what we pay our players in prizes afterwards. Page 8 is just net ticket sales for the given years, and that was put in just to show you that in 20 that we only got $28.3 million from our jackpot games. The year before we got $49.4 million. It's quite a dip, as you would say, and if you were looking at your economic trends. And again, on page 9, I like graphs a little bit better than I like the charts. It just shows you in a graph style basically where we were with our games. There was some good news last year. We reformatted our scratchers. As you'll see on page 9, we were up about $4.4 million in scratchers. It helped offset. I think mid-year we were thinking we were going to return about $35 million to the scholarship fund. We were able to tweak our game a bit and return an additional $3 million that we did not think mid-year we would have because of everything that was going on in COVID. Obviously, y'all had a long conversation about COVID, but it has impacted the lottery also, so it has impacted every business. At one point, we had about 10% of our retailers closed. We're very fortunate that our convenience stores and grocery stores are critical businesses, so they've remained open through the crisis. So we've done our best to, within the governor's dictates, to get out and service our people, but we have been following, as far as a work protocol, everything that the governor's asked us to do. We come in and out of the office in shifts so that we make sure that not too many people are in the office at any one time. And basically coming today, I told people not to come with me just to make sure it was a little bit easier. But on page 10, you'll also see the fiscal year 20 and 21 comparisons. And you will see, and Mr. Valenzuela and I were talking about this just a minute ago, we have a little more good news this year, and we're continuing our upward trend a little bit with our scratchers, and we're up about $3.1 million this year. I will tell you, in looking at the tea leaves, and we look at tea leaves when we're in the lottery, because it's about 50-50 when we give you a number, as you were talking about, but we think we're going to be closer to $40 million this year as a return, as I sit here today. If something happens with COVID or we have another outbreak, that could be adjusted, but we feel pretty good about where we are. As you'll see once again, the jackpot games are down 12% this year already. Last year I joke about it, but we had the year of the jackpot. We had I believe it was 12 to 14 winners of major games, so the jackpot could never reach a level where it actually brought in the players that play at higher jackpots. The other problem with that, and you might have seen this if you went to buy a Powerball ticket, is we used to have a guaranteed jackpot starting at $40 million. We rolled it back to $20 million because we too had liquidity problems and couldn't actually fund those starting jackpots anymore at $40 million versus 20. You'd also notice that our rolls were in increments of $10 million per draw cycle. We rolled that back down to about $2 million too, just to be able to afford to pay a winner in the game. So the game has been struggling, like I said, but those are things you would have noticed if you actually went and played a Powerball ticket, Mr. Chairman. Page 9 is just a overview of unclaimed prizes. As we've talked about year in and year out, one of the issues this year when we didn't have the sales with our jackpot games, if people aren't playing, those tickets that are $1 and $2 tickets that they actually win on don't get claimed. So this year we actually have suffered in the unclaimed prize funding coming back in because we have less people playing our games, so we have less winners that don't collect on some of the smaller prize amounts. And page 11 is simply an overview of the past 3 years. We have stayed pretty much between 1.5 million and 2 million in what we have in unclaimed year in and year out, and that's actually helped us sort of balance out our scratcher portfolio that we've talked about over the past 3 or 4 or 5 years. So that money is vital, as we've talked about. The students get it on the back end instead of the front end, but they do get that money. So just to clarify that. And Mr. Chairman, that really gives you the highlights of sort of what's happening in the lottery today. I tried to distill it down to the numbers. We've talked at great length in the past about other issues impacting the lottery, and I didn't put any of those in the presentation today, but if you have any questions, I feel we're on solid ground this year to come in between 38 and 40 million again. So we will be at that level unless something else changes, either statutorily or we have another COVID outbreak.
Representative Anderson?
Thank you, Mr. Chairman. Sir, I appreciate the work you do for the college-bound students of New Mexico. This lottery program has achieved intended results, and the concern is declining support for our college-bound students. So I think to myself, sir, that what does he need to do? He needs to either grow the pie or we need to take a bigger piece of the pie. And I'm aware that the bigger piece of the pie is really sort of a non-starter because that's code words for less payout to those who choose to play. So then I think, okay, what are your choices? You got to have more products, and I heard you comment on that. And I thought, now is there anything we have to do statutorily to allow you to make more products? Then I hear about international, and I think, why aren't we already allowing international play to the New Mexico lottery? Or are we, and I just misunderstand the point? So I'm really asking you, sir, if you're aware of any statutory changes that are needed to better enable the lottery program to deliver more scholarship funds to New Mexico college-bound students.
Mr. Chairman, Representative, an excellent question. I will say that there are a number of things you can do. Obviously, I have a new board this year, and they haven't taken up any of the items that I might talk about. So anything I might say would be totally my opinion on the subject. Obviously, I've been in the business for 20 years. I hold multiple national offices. I've started 2 lotteries. I've been an expert witness in the start of Alaska and Alabama recently. So the things that I would say are generally things that you'd probably think about. You either have to have a new game, you have to expand your lottery base in some fashion, such as iLottery, which allows an individual to perhaps buy a lottery ticket online instead of standing in line at the convenience store. And I will say during the COVID period, the conversation regarding us making it safer for our players to actually buy a ticket like that from a national level and my peers has been one of the things we've talked the most about, just because it is the most simple thing to do. Do you want someone standing in line, or you want them to have the ability if something happens that they can just get on their phone like they bank or buy airline tickets or whatever they do? More people are using their phones and computers to do things like this today. Now, I will say, to stay relative, and I was on a panel 2 days ago talking about scratcher tickets. For us to stay relative in the marketplace, and I've got a 24-year-old and a 26-year-old, and so I have a focus group of 2, and I ask them, would you play lottery? And it's like, Dad, I'm not playing lottery. I scratch the back of my head and I say, well, why? And they said, well, if I can't do it on my phone, I'm not going to do it. I don't want to stand in line. My time's too valuable. I want to be doing other things with my friends. They said it would take 30 seconds for me to get on my phone and buy a ticket, but I can't do that now. And I said, well, that's a lottery issue, and it's across many states. It's not just here. So it's one of the things that is getting talked about to actually help. If you were to have a crisis, you'd have the ability to allow people to stay at home and actually play your games. And someone raised a very interesting point in this conversation we were having on Wednesday. They said, I'm surprised we haven't had an ADA complaint filed against us. And I'm a lawyer by trade, and I went, wow. I said, there's not a good reason I could give to a court not to allow somebody the opportunity to buy a ticket online and with a disability.
Thank you. Thank you for that answer. It only leaves me with one last question. And again, we're only remind us all that we're running short. One of the arguments, should New Mexico consider increasing the payout to make the game more attractive to those who choose to play? There is an argument that I believe says if you'll pay out more, you'll make more money in the end. And that is a philosophical point that each one of us struggles with, and I would be curious if you could enlighten us of your opinion on that.
Mr. Chairman, Representative, a lot of tough questions you're throwing at me without really having conversations with my board about sort of their views with the lottery. But I would tell you this, and it's just factual. There are probably 2 other states in the country that have any prohibition on how much you can pay out as a prize.
Go ahead and speak into the microphone.
There are probably 2 or 3 states that have a prohibition. Louisiana just recently changed their law. They had a prohibition like we did. They also took theirs down to 25%. We've talked about it for 5 years. Probably the chairman's tired of looking at me over that period of time. But you have to ask yourself, if 43 jurisdictions do it one way, and you're just about the only jurisdiction doing it totally the other way, what's the business model you want to follow? I will tell you that over the past years, the growth in the industry for scratchers has been 47% over about the past decade. Our growth was negative.
Thank you. And our growth was negative because we choose to pay out less than the national average.
Yes, sir.
Thank you. And is that policy set by the lottery board, or is that statutory?
Mr. Chairman could probably go into great detail about that. It is a statutory provision, and it's something we've talked about, tried to compromise on, Representative, over the past number of years.
Thank you. Thank you very much for that. Good luck going forward. Thank you, Mr. Chairman.
Additional questions from committee members? We've got a couple online. Representative Hodgman Vigil has a question. Are you online?
Yes, Mr. Chair, I'm here. Can you hear me?
We can hear you.
Thank you, Mr. Chair. Mr. Barton, I just have a couple of questions. You've addressed majority of what I had for you, but can you just remind me of what your experience is, and if you have national experience with other lottery associations or organizations?
Mr. Chairman, Representative, I serve on and chair the legal committee for our national group, Multi-State Lottery Association. I'm in charge of negotiating our compact with the Aussies down under for international sales. I've been the Powerball chair in the country and ran that game for a year. So yes, I've had experience across the board. Started as a lawyer in South Carolina way back in 2020 after I left the South Carolina Senate.
Okay, thank you, Mr. Chair and Mr. Barden. You've already gone over this a little bit, but I just kind of want to get definitive answers from you on this. So is there a definitive connection between the fiscal year 2020 fund and tuition payments and the lower players' prizes that we're offering?
It is my opinion, from my years in the lottery, yes. Mr. Chair.
Okay. Thank you, Mr. Chair and Mr. Barden. And so is what you're telling us today is you have a concern with New Mexico's payouts compared to the other states that you've worked in or worked with?
Mr. Chairman, Representative, I would tell you that if it were my business, speaking only for myself, that it's one of the things that I would like to change. So I would ask for more money for prizes so that the games were better, so we were more competitive. In Arizona has a 70% payout on their scratcher game. We have a 54% payout. Texas has a similar payout. So we get emails all the time from people who live down around the border in Texas. And basically they tell us, we're going to Texas to buy our tickets. We're going to Colorado to buy our tickets. We're going to Oklahoma. Recently changed their law and has been very successful. So it is one of the components. We wanted to make sure, as this was discussed in the past, that the students had some sort of base also, and we felt that that could occur as far as a minimal transfer each year. So we've worked on a compromise year in and year out, and hopefully at some point we will get to a compromise.
Okay, thank you, Mr. Chair, Mr. Barton. This is the real crux. This is the information I'm really interested in getting out of you as a legislator. And so I need to know definitively that if we worked on that 30% pay mandate, would the increase in money that comes in go directly to revenues for tuition increases, for tuition assistance, especially during COVID when we have concerns with people either enrolling in or staying in school? Is that something that would directly translate?
Representative, Mr. Chairman, from all my years in the South Carolina Senate, and I did budget provisos, I never used a percentage to actually plug in my budget when I was doing a budget proviso for a member. People wanted to know the actual dollar amount. I will tell you, I can always give you the 30%. It's very difficult. Don't get me wrong. I'm managing to the month. But I can give you a higher dollar amount, but a lower percentage. And if you do the math, you will look at one of the charts I gave you. You'll see that the percentages are flipped, where the money actually went up, percentage actually went down, but you got more money. So that's how that works. But we've had those discussions. I hope we continue to have those types of discussions. They're very meaningful.
Okay, thank you, Mr. Chair. That's all the questions I have.
Representative Javier Martinez.
Thank you very much, Mr. Chair, and good morning to everybody. Thanks for the presentation. I just have a couple quick questions that I wanted to ask. First of all, congratulations on that 25% increase that the Journal reported last week. As we spoke yesterday, Mr. Chair, about gambling and expansion of gambling, one of the concerns that came up was this issue of lower income people or people on fixed incomes spending their money and gambling it away. Sir, do you have a sense of where that increase comes from? Do you track the zip codes, for example, where your lottery tickets are sold?
Mr. Chairman, Representative, because any prize under $500 can be claimed at a convenience store, we cannot track that.
Okay, and the reason I ask, Mr. Chair, is one of the problems that we've seen in the past is that the market for these scratchers tend to be in lower income communities. A report I read a few years ago, I think, had it upwards of 70% of those who purchase lottery tickets coming from specific zip codes under specific income levels. And that's clearly concerning to me because in fact, what we've done with the lottery scholarship is we've had lower income people subsidize middle class and upper class students to go to college. At the same time, Mr. Chair, as much as we talk about the lottery scholarship, the reality is over the years we've reduced our own legislative investments in higher ed, leading higher ed institutions to increase tuition and leading us to this position that we are in right now, where the lottery scholarship, it seems to me every year I've been in the legislature, it's been a fight to keep it afloat. So, Mr. Chair and presenter, I hear some of your plans or some of the ideas that are being proposed, such as increasing payout, for example, or even online gaming. Beyond those two, does the Lottery Authority have any type of strategic vision moving over the next 10, 20 years to either improve the lottery scholarship or rather the lottery program or to make drastic changes to it one way or the other?
We're not going into this, but it's here so that.
Mr. Chairman, Representative, I will tell you our board's having a meeting this coming week, and one of the items that we will talk about are exactly what we've discussed today, what we can do for the future. I will tell you, though, that when you start looking at 10-year or 20-year plans, you go out and look at the states that are very successful with lottery. So the successful states do not have a required return. So it's the cart or the horse, where do you want to put that, so to speak. But I'm very mindful of your comments. I understand what you're saying. I think some of the national information isn't quite as strong as what you've said as far as the dollars. I really haven't seen a report like that says it impacts that segment of the population to that extent. I would love to see that if you know where it is, so you could share it with me.
Absolutely, I will do that. I will reach out with that. And then lastly, Mr. Chair, in terms of online gaming and ADA, I mean, I as a lawyer myself, I mean, I just don't think that's, if we are going to propose an expansion through online, I don't think ADA is necessarily the reason for it. I think there's a lot more to ADA compliance than just allowing people to buy tickets online. One last question, and I'm not even sure this is to you, so just correct me if I'm wrong. You don't deal with eligibility for lottery scholarship, correct? All you deal with is bringing in the money.
Mr. Chairman, Representative, that is totally correct. I'm glad we don't.
Okay. So I'll save the last question. Thank you so much. I appreciate the time.
Thank you, sir.
Additional questions? Representative Garcia.
Thank you, Mr. Chairman. David, a couple of years ago, you introduced some legislation dropping the percentages and upping the percentages on the winnings. And Representative Anderson asked a question, and you said that if you don't pay out, you don't make any money. What was the difference when that legislation was introduced to where we're at now?
Mr. Chairman, Representative, I think Mr. Chairman could probably talk more about the legislation since it was your legislation, but we're literally in the same spot we were 5 years ago.
I can't understand you, sir.
I'm sorry, Representative. We're in the same place we were 5 years ago when we started talking about these issues.
Mr. Chair, so basically what we did then didn't improve anything, right?
Representative, Mr. Chairman, Representative, we didn't do anything.
Thank you, Mr. Chairman.
Additional questions? As a side note, you alluded to the fact that you have new commission.
Yes, sir.
What is it, 5 members?
It's 7.
It's 7.
Mr. Chairman.
Have they all been replaced?
All but 2.
Okay. You happen to have those names in front of you today?
I do not have them with me, but I can get them to you very quickly.
On that, do we know where they're located from?
They're across the state, so we have different people.
Okay.
They'll all be, I think their letters from the governor's office will be reissued coming back to the Senate during the next session.
Okay. On that. Fair enough. Certainly appreciate that. From the committee's standpoint, we listened yesterday to initial discussion on modifying the Racino gaming. I think the revenues that we're talking about to the state of New Mexico are roughly $70 million. That was pre-COVID estimates. Keeping in mind that those facilities have all been closed for the most part on the gaming side. So if that extends for a full year, we won't be getting the 70 million. We'll be getting zero on that. So that's less money that goes to the general fund. In the event of the lottery, when we're talking $40 million, understand that it's earmarked for higher education on that. But we're also supplementing, in addition to that, because the lottery is now a mature lottery on that, and the revenues are extremely stable. But as we have to supplement more, do you remember what it was, David? 20 or 30 million? Well, my point is, it's hitting the general fund, folks. You've got 70 million and 30 million, and so you don't think there's a problem when you have talking about a 29% reserve, which would be about a $2 billion reserve from that standpoint. And this is just basically in two categories. So it has a general fund impact. Put in 97 million for okay, on that, I was thinking it's higher, but 9 million in general fund money. As long as the general fund and oil and gas keep, if they start coming back, we can afford to do it. But you're reaching a point that you're talking real money, and some cuts have to be made. I guess unfortunately, the positive thing that's happened right now is declining enrollment in higher education, and I don't perceive that as positive, but that's happening across the country on that. But I only point this out that you have a demand on the general fund, and the sources of those funds are moving in the wrong direction from that standpoint. So thank you very much. Oh, we have a question from Senator Sanchez.
Thank you, Mr. Chair. It's not really on the lottery on that, but on the gaming revenues, the revenue sharing. David, do you know if, because I know the third quarter of which was January through March, was deferred by the governor that the tribes didn't have to pay that. How has that affected the general fund? And we know the last quarter they were closed, but do you know how that's affected the general fund as far as cash?
So, Mr. Chairman, for the fourth quarter last year, there were virtually no revenues. They were allowed to defer payments by governor's action. However, they would have had to pay interest on deferred payments. And our understanding is there have not been takers on deferring payments and paying interest. So the tribal gaming, some of them will have resumed operations in the quarter that ended this week, September 30th quarter, some operations gearing up, and more so in the current quarter. So again, we're getting about 20 million a quarter, we believe, and it'll go from zero up in an upward direction, but we don't have more specific info.
Any questions? Okay. Thank you very much. Appreciate it. Anything else, David? Well, want to thank the staff for having to move us from one chamber to the other and taking care of all of our goodies as they've always done. We've been very fortunate with staff, and I know collectively we're all very appreciative of their efforts on our behalf and also the citizens of the state on that. We wish them well, and we wish you all a safe trip home. And we hope the virus is checked, and we hope the revenues are on a sustained course to assist the state of New Mexico and all of its financial responsibilities. So thank you very much. Thank you.
Thank you, Mr. Chairman.
Hey, John. See you soon.
Okay. Coming for the okay. All right. All right. Fair enough. Thank you. We'll see you. Have a safe trip home.
I will. I will. You do the same. You got a little farther.
All right. Take care.
Bye, Rebecca. We'll see you. Yep.